And let's get started. As per your requests, our next review is here. All hail Lord Rahim from the planet Gonstead. He just got off the mothership after swinging down by Australia to drop off Dr. Ian. I love the way that he sits at eye level with his patient, not making himself above or below. He's saying, you are equal and I am listening, I am here. Eye contact, pro level.
Now, what brings you here? Pain, L4, L5.
L5 pain.
And he's going to start off, wasting no time at all, by answering his own questions. And here's the story. We have a male patient, mid to late 40s. He was the passenger in the back seat of a car traveling 45 miles per hour when the door opened and the patient, and it seems we have a communication difficulty. I'm unsure whether or not the patient fell out of the car or whether or not the car itself turned over and rolled.
Oh, you rolled.
The car flip over.
Wow, okay. You were racing?
No.
Or whether this is just the traditional drop-off for the Trinidadian Uber driver. The patient is ambulatory with the help of a crutch or a 2x4. He's had the pain for 10 years, and it's been more acute in the last 3 years with a sciatic-like pain traveling down the back of his left leg. Now we've got a quick cut. Something was edited out there. It seems as if Dr. Rahim has already identified a sacrum and an iliac dysfunction. He's going to have him walk the line here. And on the walk, he's observed a sacrum or ilium dysfunction. And now he's going to have him march in place. And he's finding dysfunction on the other side. Now looking at the right ilium. Now observing the glute fibers. Here, he's looking for the symmetry, whether or not the gluteal fold or the gluteal crease is higher on one side or the other. He's also looking for the roundness or the flatness of the glute muscle. He's noticed that the right is flat and higher, which means the ilium has traveled upward and inward. And the left ilium has traveled down and out. And here's the nervoscope reading. We've got a break at T9 and also at S3 and S4. And there's no break at L3, L4. Dr. Rahim seems skeptical about that L3, L4, which was the question he answered back in the very beginning, and he did not find a break there. And he's now indicating that the sacrum is most likely the primary cause of the sciatica. The static palpation seated using a digital examination, counting down the thoracic spine, 6, 7, 8, and
9.
T9 positive. And now moving down through the lumbar and the sacrum, S3, S4.
4, 3.
Positive pain, and that correlates to the nervoscope reading. Dr. Rahim is now triangulating in on his target. And here's the adjustment. He's going to start off with a side posture. He's got the left side down. Dr. Rahim goes skin to skin contact. And the adjustment.
There we go. You got to give me that shoulder.
Ow!
Gotcha.
Wow!
And the patient lets out a groan. They probably heard that one in the waiting room of Dr. Jason's office. He's going to have him stand up and take that for a test drive. The walking helps integrate the adjustment into the rest of the spine.
Many techniques focus on one region of the spine, whether it's upper cervical focusing on atlas or Gonstead focusing on pelvis. These techniques expect the adjustment to integrate into the rest of the spine, perpetuating self-alignment like a domino effect. It's the kinetic chain, my friends. Everything is connected.
Now he's going to have the patient lay down on his right side, his left side up. This may be problematic. Flexing the left hip may increase the stretch on the sciatic nerve, and there's some communication happening there. He's going to go in for the adjustment anyway.
To me. Give it to me. There. Gotcha. That's it.
And after that adjustment, he's going to have him take one breath, and again, pushing himself back up into seated position. And he's going to have him take that one for a test drive to help integrate that into the rest of the spine. And it appears we just had an outfit change by Dr. Rahim, indicating that this is a new day. He's going to go with the short sleeve clinical V-neck. And he just indicated that this is now 5 days later after that adjustment. That did appear to be the initial adjustment. We are now 5 days later. There's probably been several adjustments in between that adjustment and this one now. He's going to ask him some questions about changes in his pain. He no longer has the sharp pain radiating down into his legs. He now has a stiffness into his buttocks. And so there are two levels of improvement. The pain has reduced in severity from sharp into a stiffness, and also it is no longer radiating down the length of his leg. It is only moving into his buttocks. We're going to jump right into the adjustment here, again with the right side down, left side up. Again, is this going to be problematic for the sciatic nerve?
Come forward right now. I got to give you what you need.
He's going to give him what he needs. He's flexing the left thigh, and that's increasing the stretch on the sciatic nerve. And Dr. Rahim's now indicating that he's going to switch over to the other side and go left side down, which only means one thing in concept. Dr. Rahim's going into the bullpen. He's going to call out.
So there's this one, there's this one, and then there's the Cobra.
The Cobra grip, the snake charmer, the Cobra. I haven't seen the Cobra in a long time. This is very exciting for me as well.
Like the Cobra. Okay? Ah, the Cobra!
Okay, this just in, I'm getting word from the other side of the internet that there is footage of Dr. Ian performing the Cobra maneuver. Let's swing down to Australia and take a look at that. He's got a severely acute patient here.
You can see Dr. Ian has to lift the patient's leg up, and he is in absolute agony right now. His left side is down, and as you can see, as he's flexing the leg, it's increasing the pain in the patient. Just like in Dr. Rahim's video, we're going to see Dr. Ian flip him over to the other side to perform the Cobra maneuver. And watch the difference as Dr. Ian uses a quick, gentle striking motion, more so than a sustained pull.
Relax it. Give this a little push in a minute.
Let's see if that's effective. Of course it is. 3 days later, this patient's ready to do jumping jacks. Okay, we're back to Los Angeles, California. Dr. Rahim is now setting up on the knee chest table. It looks like he's going to use a right hand contact. And we're going for that lumbar spine here. We're down at that L3, L4. Dr. Rahim has done all he can do for that SI joint, and he's going to have to go ahead and manipulate the actual segment. And here's the lineup. He's letting the patient know that he is on the same level, that he felt it just as much as him. Let's see if it's effective as the patient stands up. And here comes the patient. Dr. Rahim says, "Rise and be healed, child." Interesting, Dr. Rahim also just made reference to enzymes. Maybe he's using turmeric and bromelain, further expediting the healing process and decreasing of pain symptoms in the body for the patient. Okay, we've got another outfit change, which means we're probably about 2 weeks later, is now indicated by Dr. Rahim. Does not have back pain after 2 weeks of care. This back pain had been going on for 10 years, but it was 3 years of constant, progressively worsening back pain. And Dr. Rahim has taken care of that here in 2 weeks for the patient. He has no sciatic pain, and he's going to go ahead and scan the body with the scope. And the main problem again at L4. So the first layer was really the sacrum and the ilium, but now we're getting down to the deep, to the heart of the problem. The question that Dr. Rahim answered himself in the beginning was that L3, L4. Remember, it didn't even show up on the first nervoscope exam, but now it's showing up here towards the end of care. And he's teasing him. How do you want it? Do you want right side down, a push, a pull, knee chest, cobra? Is he going to make a decision? Going. Sold to the cobra. And in the cobra, we're pulling the L4 down onto the L5. L4 has traveled posterior and superior, and the cobra is now pulling it down and back onto the L5 into alignment.
Right there. This is a cobra. The cobra is there. Boom. Good.
And completely solid adjustment. Dr. Rahim does it again. And he's going to bring him over to the knee chest table for the last adjustment. The timer on the video is progressing towards the end, which only means one thing, folks. And that is we are coming to the bottom of the 9th inning, 2 on, 2 outs. Dr. Rahim is up by a run. And if he's going to close this thing out, he's going to have to shut down the other team. This L4, L5 is going to need to be taken care of. Rahim takes the mound. He's lining up carefully. He gets the sign from the catcher. Here's the windup and the pitch.
Gotcha.
And he got him. Strike 3. He's out of there. The man from Trinidad will be sent home.
Tell me.
I don't need no 2x4 anymore.
No longer needing the 2x4.